Nutrition for dental health. It's really important that we keep an eye on what it is that our clients are eating. With dental health, it's all about the frequency, not the actual amount of sugar consumed. And I always use the example of on Halloween. So you send people out, they go trick-or-treating, they gather tons of candy, and I believe from a dental standpoint, it is far better to just gorge on it all and just go to town with it, as opposed to eating a little bit. People who are grazers and they eat a little bit here, a little bit here, and a little bit here throughout the entire day are actually bathing their teeth in a lot more sugar. So what happens with sugars in the foods that we eat is it creates an acid in our mouth and our saliva becomes acidic, and that's what causes cavities. The acid actually burrows little holes into the structure of the tooth. So if we decrease the amount of sugars and the frequency of which we're causing those acids to be on our teeth, we're going to find that we get a lot less decay. I think we really need to pull out our labels and read what we're eating. So on this, I just grabbed a Greek yogurt because it's really low in sugar, really high in protein, and that's going to be an excellent snack. But on this label, it says 7 grams. So we read off the label, sugars, 7 grams. 4 grams equals 1 teaspoon of sugar. And that way you have the power to do the math and figure out exactly how much sugar you're consuming. Many of those sweetened yogurts that we find over the counter have more than a 1/4 cup of sugar in the yogurt container. That's a lot of sugar in a small container, so we really want to be careful with that. We're finding hidden sugars in so many things that we think are healthy. Granola bars have a lot of sugar. Any foods that are going to be sticky and chewy, those are going to have long-lasting effects on the teeth because it's going to keep the saliva very acidic as it holds all that food still on the teeth. Also be really careful with pop. I have this personal thing where when I talk about pop, I always say pop is poison. And I want people to understand pop is a really, really big problem for dental health. What happens is whether it's sugared pop, like a regular pop that has corn syrup in it and sugar in it and a ton of calories and offers nothing of nutritive value, or even if it's a diet pop, which just has a lot of chemicals, still offers nothing of nutritive value but no calories, both of them are causing a lot of changes in the mouth. They all cause a very acidic environment, which is going to cause cavities. And now studies are showing us that there's a lot bigger issue than just the dental health with drinking pop. It's causing holes in the long bones. It's causing, signs of osteoporosis, which contributes to tooth loss, and just all around pop adds nothing to us. So what I'm recommending for our clients is stick with water, stick with 100% natural fruit juices, and do the consuming of the juices when it's with a meal so that it's not going to be an acidic problem. And always it's best to have a regular piece of fruit than it's going to be to have a juice. But stick with milk, stick with juice, stick with things that are found in nature. Pop just doesn't add anything for us.